Good morning everyone. Myself Dr. Sharat Chand Gupta is going to take a class on physiological and maternal changes with the pregnancy. So, can you tell me what do you mean by the pregnancy? Anybody from the whole class? So, okay, I'll explain the word pregnancy. Pregnancy is a period of adaptation where the woman is going to achieve so many changes in her body, whether it is a physiologically or anatomically as well as its surrounding environments. Here she has to take a new things or new change or a new challenge in her life regarding the pregnancy. Usually the duration of the pregnancy will be 280 days. When we'll talk about the lunar months, it is going to become 10 lunar months, and right now it's a 9 calendar months. So what is the meaning of lunar months? So lunar months, it's going to be 28 days of duration per month, and if it is 10 lunar months, so 28 multiplied by 10 is equal to 280 days. And when we'll talk about the 9 calendar months, so it is going to become again 280 days. If it is a leap year, then the Feb will be 29 days, and when it is non-leap year, the Feb will be 28 days of duration. So total 280 days of the duration of the pregnancy will be there. So usually so many changes which is going to be takes place in the pregnancy, and there is an adaptation which is going to be achieved for a mother also who is getting pregnant, as well as her newborn or her fetus which is going to become in her mother wombs. So there is a change adapted by the fetus as well as mother, and meeting the stress of the pregnancy as well as labor. Next, we'll talk about the genital organs. In that, first we'll talk about the changes occurring in the uterus. The size of the uterus in a non-pregnant state will be 7.5 centimeter into 5 centimeter into 2.5 centimeters. Whereas in the case of pregnancy, due to the term of hyperplasia as well as hypertrophy, the pregnant state uterus will be going to be gained 35 centimeter into 25 centimeter into 20 centimeter at the age of term, in comparison to non-pregnant state, and the volume is going to be enhanced by 1000 times. If it is a 1 ml in the non-pregnant state, so it will going to become 1000 ml. Next we'll talk about the weight. The weight of the non-pregnant uterus will be 50 grams, and in the case of pregnant uterus it is going to become 1000 grams. So exactly we can see it is going to become 20 times in the pregnancy time. Weight gain will be there. And the shape of the uterus is going to be, again, if it will talk about the non-pregnant state, the shape of the uterus will be pyriform shape, then it will becomes globular at the 8th week of gestation, again it will becomes pyriform shape, and it is going to be adopt the pyriform shape at the 16th week of gestation, and it will be at the age of term, this will be remain pyriform shape. Next will be talk about the position. The position of the uterus will be dextrorotation. Dextrorotation meaning is that it is going to be rotated anteversion as anteflexion, in terms of, because the rectosigmoid colon which is going to be located at the left side and which will make the shape of the uterus is going to be slightly tilted towards the right, and that is going to be known as dextrorotation. Next we'll talk about the consistency of the uterus. The consistency of uterus is progressively going to be get softer because of increased vascularity and presence of amniotic fluid. What is the meaning of increased vascularity? This is because of the process of known as hyperplasia. The multiplication of new cells will going to be takes place, which will be resulting into the generation of new blood vessels. There will be increased vascularity, and this will result into production of, along with that there is a presence of amniotic fluid. So there will be, the uterus will become softer and softer at the age of term. Next we'll talk about the contractility. Contractility is going to be described in two terms. One is known as the Braxton's contraction, that is going to be resemblance with the false labor pain, whereas a true uterine contractions which is going to become as a form of true labor pain. So when we are talking about Braxton's contraction, it is going to be seen throughout the pregnancy, and it starts with the second trimester of the pregnancy, and it will be end at the age of term. But when the mother is heading towards the term age gestation, she is going to be convert this Braxton's contraction to the true uterine contraction, and in the case of true uterine contraction, you will be seeing that the mother will be going to be having the labor pain, and that is going to be increased till the age of term, and that will result into degree of dilatation of the cervix as well as degree of descent of the fetus, which is going to be heading towards the labor process. Next we'll talk about the capacity. The capacity of uterus is going to be increased from the non-pregnant state from 4 ml to 4000 ml at the age of term. Next we'll talk about the myometrial changes which is taking place in the pregnant uterus. The main things which is going to be seen in the myometrium is the word of hypertrophy. This hypertrophy is made by the means of estrogen effect, and whereas the hyperplasia which is going to be made by the progesterone effects. It will start from the initiation of the pregnancy period and it will go till 14th week of gestation, and then the fetus is exert a direct stretch. What is the meaning of hypertrophy? Hypertrophy meaning is that increase in the cell size, and whereas a hyperplasia meaning is a multiplication of new cells. So both the process is going to be promoted by a hormone. The hyperplasia is promoted by a hormone known as progesterone, well known as the pregnancy hormone, whereas a hyperplasia is going to be promoted by a hormone known as progesterone, and whereas a hypertrophy which is going to be promoted by a hormone known as estrogen. Next, the formation of LUS, that is known as lower uterine segment. In terms of lower uterine segment, when we will talk about the lower uterine segment, it will be going to be enlarged from the isthmus and it will be going to be come to the half of inch of the body. Next is the formation of LUS, which will be initiated after 12th week of gestation, where the isthmus will be 0.5 centimeter and it is going to be expand gradually from 0.5 and it will go to the 10 centimeter in the length with the formation of lower birth canal. Whereas in case of upper uterine segment, the peritoneum will be firmly attached and myometrium which is going to become in the form of 3 layer, and the outer is going to be known as longitudinal, middle is going to be known as oblique, whereas the inner is going to be known as circular. They will be going to be form a special type of arrangement of the cells which is going to be known as figure of 8. This figure of 8 is nothing where this will be helpful to prevent the excessive bleed which is going to be happen when the mother is heading towards the labor, and this will be helpful to prevent excessive PPH, that is postpartum hemorrhage, and by the means of opening of uterine sinuses. The uterine sinuses is going to be occluded by this figure of 8 and helpful to relieve from excessive postpartum hemorrhage in the mother. Next is, when we will talk about the upper uterine segment, the decidua is well developed, the membranes are firmly attached, and the activity which is going to be held in the upper uterine segment is active, contract, retract, and it's become thicker during the time of labor. Whereas when we talk about the lower uterine segment, its peritoneum is loosely attached, myometrium is 2 layer, outer is longitudinal and inner is the circular. When we'll talk about the lower uterine segment, again the decidua will be poorly developed, membranes are loosely attached, and the activity in case of upper uterine segment we had seen it is active, whereas when we talk about the lower uterine segment, the activity is passive. It will be dilate, the dilation of the this birth canal will be there, stretching of the birth canal which will be resulting into the dilatation of uterine cervix, and dilatation of birth canal becomes thinner during the time of labor. Where when we talk about the upper uterine segment, it is thicker. There is a thicker, and in the lower uterine segment the uterus layer will be thin over here. The junction between upper uterine segment UUS versus LUS, lower uterine segment, it is thick and it will be going to be known as physiological contraction ring at the level of symphysis pubis. We are not able to going to be seen left, it's going to be seen. Next we'll talk about the uterine blood vessels. Uterine blood vessels is going to be known as uterine artery lumens. It is double in number and its blood flow is going to be enhanced from the pre-pregnant state to the pregnancy state 5 times. So 5 times the uterine artery lumen is going to be enhanced and it is going to be increase in the blood supply. Myometrial and decidual changes which is going to be seen over here is there is a spiral arteries which is present over here is going to be undergo a fibrinoid degeneration, and due to the 2 waves with the trophoblastic migration, so that it becomes dilated and to be becomes uteroplacental arteries. Uterine blood flow is going to be increased progressively at the age of term, and it is reaches to 500 ml per minute at the age of term. Next is the changes which is occurring in the cervix. It becomes hypertrophied, soft and bluish in color, and due to the increased edema as well as increased vascularity. Soon after the conception, a thick cervical secretion is going to be obstruct the cervical canal and going to forming a mucus plug. The endocervical epithelium is proliferate and everted forming cervical ectropy, and that is going to be known as cervical erosion. Next, changes which is occurring in the fallopian tubes. As you all know, the fallopian tube, the scientific name of fallopian tube is sulfinges, and these sulfinges are going to be supported by a ligaments that is known as the round ligament, which is in the round in color, and as a broad ligament. Both will be suspended below the ovaries, and they will be going to be support to this particular ovary. So this fallopian tube is inactive, elongated, and there is a marked increase in the vascularity, and they may be broad ligaments, which is going to result into the varicose vein in that particular region. Next, changes occurring in the vagina. The vagina is become soft, warm, and moist with the increased secretions and the violet in color, Chadwick, and that is going to be known as Chadwick signs, and which is well-known sign, and because of increased vascularity. Next, changes in the vulva. It becomes soft, violet in color, and edemas and varicosities may be going to be developed. Next is changes in the ovaries. Both the ovaries are going to be enlarged due to the increased vascularity, edema, particularly to the ovary which contains the corpus luteum. Next, changes in the ovaries. Again, the corpus luteum continues to grow till to 7 to 8 week of gestation. Then it stops growing, it becomes inactive and start degenerating at the 12th week of gestation, and completely going to be degenerated after the labor. The corpus luteum is going to secrete the special hormone known as estrogen, progesterone, and the relaxin hormone. The changes in the ovaries. Ovulation ceases during the pregnancy due to the pituitary inhibitions by the high level of the relaxin is a protein hormone. Its exact role of the pregnancy is unknown. It may include the softness and effacement of the cervix. So till now I had explained about the uterine changes, and students, I think you had learned something from my class, and the rest of the topic and other changes like hematological changes, cardiovascular changes, and other changes we'll be seeing in the next session. So thank you so much for having a patience with my class, and I'll be hoping you have a wonderful time with me, and hope a wonderful day also. Thank you so much once again for continuous having a patience and listening my lecture. Thank you so much.